Hey, so today we're just talking about ankle sprains, and more specifically acute ankle sprains. So over the years I've had a few patients that have come in who have injured their ankle and then gone to a clinic or something like that and got their ankle wrapped, and then by the time they come in to get a bit of treatment, they don't know how to wrap their ankle themselves. So it's just a good little bit of information that you can pass on to your patients. So today we'll just demonstrate how to do it properly so that you can help your patients out, or if you're working with athletes and they have an acute sprain but need to get back on the field or back into their sport or whatever, it's good to know how to do this just to give the ankle that extra support. So typically with ankle sprains it's going to be an inversion sprain, which means that the ankle actually flips or turns over this way. So when we wrap it, we want to give it as much support as we can in order to bring it back this way to relieve any tension and through the lateral side of the ankle. But basically just to give it as much support as we can so that people can go back to being able to walk effectively on it or get back into sport or whatever they do. So your tensor typically comes with these two little clips. So what we want to do is just come across the foot, get one good wrap on the foot, so now you've got a little bit of an anchor with your tensor. So just come up underneath, and each time you come up the side of the foot, you're going to put a bit of tension there in order to get that, to reverse the inversion. So come up, a little tension each time, and then you're going to wrap around the leg. Pulling up each time. And just systematically working your way further up the leg to get as much support through there as we can. So then once you've got your tensor in place, you can just take your little clips, tie it off there, and you should see this little figure 8 pattern as it goes up the ankle. And of course, every time that you wrap an ankle or splint anything, any limb, you want to do a little cap refill after, just to make sure that the circulation is good and that you haven't done it so tight that you're cutting off circulation to the toes. And then your patient should be able to go back and get more involved in their activity.